Today I'll talk about restoring teeth using the ALL-ON-4 technology. This is for those who have lost all their teeth or have very few left, and those are already in poor condition. It's one of the most common ways in the world to restore a full set of teeth. But this technology has important nuances that dentists don't like to talk about, even though it's better to know them in advance rather than 6 months after the operation. What should you be prepared for? How can you avoid overpaying? What are the real advantages of the ALL-ON-4 method? And who is it not suitable for? What is ALL-ON-4? In short, instead of placing an implant for each individual tooth, the entire dental arch is fixed on just 4 implants. They are placed into the jawbone, and a single solid prosthesis is attached on top of them. You get an entire row of fixed teeth at once, not one tooth at a time. Because of this, the patient saves a lot of money and undergoes less intervention. Let me start with what you need to be prepared for so there are no unpleasant surprises. Almost everywhere promises teeth on the same day, but in reality it takes 3 to 5 days. This is built into the technology itself. It takes time to properly fabricate and fit the temporary structure. This doesn't mean you were deceived or that something went wrong. Just keep in mind that you won't get your teeth on the exact same day, but a couple of days later. During these first days, you'll be given a temporary prosthesis. It's made of acrylic, the same material as a regular removable denture. This is done on purpose. Acrylic is lightweight and doesn't overload the implants, so they don't loosen or fall out while they're integrating. But you immediately get a beautiful smile. When you get a temporary fixed prosthesis, you'll have a lot of restrictions. For example, you absolutely cannot chew with these teeth. Imagine you've planted a tree. If you start pulling it several times a day, it will either lean or not take root at all. It's the same with implants. You won't be able to chew properly for the first 3 to 6 months. You'll only be allowed to eat soft foods, porridge, soups, food processed in a blender. No nuts, seeds, chips, meat in solid form, and so on. A temporary prosthesis has a time limit after which it should ideally be replaced with a permanent one. After 6 months, when the implants have fully integrated, they can be loaded. The prosthesis is then replaced with a permanent one made of zirconia or metal ceramics. Zirconia is significantly stronger than acrylic and noticeably heavier. In terms of how it feels in the mouth, it is much closer to your own natural teeth. It is replaced to reduce the chance that the prosthesis will break. This is exactly the point that many clinics prefer not to mention. And then, after installing the temporary prosthesis, they persuade the patient to pay extra for the permanent structure as if it were something unexpected. Although, ideally, this should be explained right at the first consultation. There is an interesting nuance. In our clinic, many patients use a temporary prosthesis and do not replace it with a permanent one. There are 2 reasons for this. First, nobody wants to spend extra money. The second reason is that our prosthesis is reinforced with a titanium bar. This does not replace a zirconia prosthesis, but it makes it significantly stronger. Why do you need to wait 3 to 6 months? The reason is that the bone needs to grow into the implant threads, just like tree roots grow into the ground. Until this happens, the implant is held in place only by the threads, and if you put pressure on it too soon, that is, start chewing, it can simply become loose and fall out. That's why during all these 3 to 6 months, chewing is strictly forbidden, so that you don't end up having to reinstall the implant. I'm sure you wouldn't want that. If you agree and like the video, give it a like. The next important point that dentists don't like to talk about before implantation is that even though the teeth are artificial, you need to take care of them just as much as your own natural teeth. For example, there is a small gap between the prosthesis and the gum. Food often gets stuck there. Over time, if you don't clean it, it starts to smell bad and bacteria begin to accumulate there. An infection can develop which may damage your gum in the area where the implants are placed. As a result, your implants could fall out. This is a major risk, which is why we give every one of our patients a free irrigator after implantation to wash away all that debris. You won't need to buy it separately. Another difference between zirconia and acrylic dentures is that dirt sticks more easily to acrylic ones and they're harder to clean. This is an additional advantage of a permanent denture over a temporary one. The recovery here is a bit more difficult than when placing a single implant. Swelling and possibly bruising may be more noticeable, although for some people it goes just as smoothly. The stronger and more intense the swelling, especially bruising, and the more actively the body reacts to this intervention, the better the healing will be. In general, during any surgery or injury, the body directs all its reserve protective resources to the affected area so that healing happens faster and more effectively. A good high-quality bone callus forms, and the implants will be more securely fixed. Are you afraid of pain during implantation? Write about it in the comments. Another point is that you'll have to get used to your new teeth. It's a foreign object. You'll feel like something large has appeared in your mouth, and at first your speech may change until your tongue and cheeks get used to the new shape of your dental arch. But this is much easier and more comfortable than a regular removable denture. And here's an important nuance that few people talk about. The ALL-ON-4 method doesn't restore the entire dental arch, but usually only 10 to 12 teeth, of which only 2 to 4 are actually chewing teeth. That's not very many. The main chewing teeth are located further back. The thing is, support on just 4 implants is limited. If the prosthesis is made longer, it will start to act as a lever when chewing and will gradually loosen the implants. That's why the prosthesis is intentionally made shorter. If you want a full dental arch of 14 teeth, you'll need to have not 4 but 6 implants placed. Then there will be enough support and more teeth can be made, but it will be more expensive. There is also an intermediate option. You can start with 4 implants and after some time add 2 more and create a fuller, more complete structure. But in this case, the prosthesis will have to be made anew. Ideally, if your financial situation allows, it's better to consider doing everything on 6 implants right away. Now I'll tell you about something that can help save time and money. In some dental clinics, you can split the payment into 2 stages. First for the implantation itself and the temporary prosthesis, and then, about 6 months later, for the permanent structure. Often, with the ALL-ON-4 method, there is no need for separate bone grafting. The technology is originally designed to do without bone grafting, but in about 40% of cases it still has to be done. Often people have very little bone left because they waited far too long to restore their teeth. As I mentioned, with full mouth implantation, we provide an irrigator for prosthesis care free of charge. We also offer a free set of 13 special products developed from our own experience to maximize the chances that your implants will successfully take hold. We also provide free accommodation for patients from other countries and cities for the entire duration of their treatment. Check with your clinic to see if they offer something similar. This can significantly reduce your expenses. And if you want to come to us for implantation, just write to us using the link in the description. Another advantage which saves a lot of time compared to restoring a single tooth. Here you don't have to wait for months with a gap or uncomfortable temporary constructions. In just a few days, you'll have a full, albeit temporary, set of teeth. I've told you all the most complicated things that are often left unsaid. But why do people still choose this particular technology? The entire dental arch is restored on just 4 implants, not on 10 to 14 separate ones. This is a significantly less traumatic procedure for the body than placing an implant for every missing tooth. The construction remains stable even in the event of partial failures. If one of the 4 implants suddenly fails to integrate, it doesn't mean all is lost. Sometimes the remaining 3 can hold the prosthesis for a short time while the problematic implant is replaced. This is a fixed construction, unlike full removable dentures, which need to be taken out at night, cleaned separately, and which can fall out or cause irritation during the day. In terms of convenience, the ALL-ON-4 option is far superior to a full removable dental prosthesis. I suggest that you ask each other in the comments whether this is really the case. This way, you'll get first-hand experiences from people who have already dealt with this. Fourth, after the installation of the ALL-ON-4 system, the chewing load is once again transferred to the bone through the implants. Thanks to this, bone tissue atrophy slows down significantly, and in the area of the implants, the bone is preserved much better than when using a removable denture. With a removable dental prosthesis, the bone is not preserved at all. And thanks to the temporary prosthesis, a person does not have to go without teeth at all. Just a few days after implantation, you can eat and speak normally. This is while the main healing process is taking place. As I mentioned, this is many times cheaper than restoring each tooth with a separate implant. And finally, the most important thing. Who is this technology not suitable for? First, uncontrolled diabetes mellitus. When medication does not help keep blood sugar under control, tissues heal much worse, and the risk that implants will not take increases significantly. Second, oncological diseases. If a patient is under the care of an oncologist, during this period, the body directs all its resources to fighting the disease, not to healing. Third, the use of bisphosphonates. These are medications prescribed for osteoporosis and certain oncological diseases. They have a significant impact on bone tissue and prevent it from recovering properly. Fourth, immunodeficiency conditions. For example, HIV. A weakened immune system is less effective at healing and the risk of inflammation is higher. Age under 18 and sometimes even up to 21 years old. The bone and jaw system is still developing, and if an implant is placed, it may shift over time. If even one of these points applies to you, be sure to discuss it with your dentist during your consultation before making a decision about implantation. Subscribe, like, and take care of yourself and your loved ones.